So when speaking with someone that has hearing loss, it is important to talk slower, not louder. A lot of people think raising their voice and amplifying talking really loud will help someone with hearing loss, but it actually does not. It does the opposite. It can be painful for people with hearing loss because we know a damaged ear is a more sensitive ear to sudden changes in loudness. So if you're really having a hard time communicating with someone that has hearing loss, try slowing your speech down, enunciating the beginning and ending of words a little bit more for them, and rephrasing the statement if it's just missed entirely. So there's some communication strategies that we know really help. So slower, rephrasing, and we know the tools that don't work, speaking louder, because of that increased susceptibility to discomfort with loud sounds. So just make sure to keep those tips in mind, and it should be an easier conversation overall. Also, when speaking to someone with hearing loss, try to limit the level of background noise in the environment. So if the television's on or music's on in the background, try turning that off or lowering the volume, because people with hearing loss definitely need a louder signal to noise ratio, so they need to hear the speech above the background or they can't separate and distinguish very well. So limiting background noise, improving lighting. So if you can turn on lights so that visual cues are more available, that is helpful instead of being in a dimly lit room. For sure, right now we know mask wearing is muffling speech quite a bit for people. So if you can, safely distance, socially distance yourself from the person, but take down your mask so they can see your mouth. Visual cues and facial expression are really important and helpful to people with hearing loss, and that is causing a lot of communication breakdown currently for our patients, is just not being able to see those visual cues while speaking to you. Clear masks are great. I really like the ones that don't fog up. So the problem is so many of them that have been kind of advertised online, and you see maybe on Amazon, for instance, or other online resources, fog up really easily. So if they go over your nose and just have a panel that's clear where your mouth is, if it's too tight or not fitting very well, it just fogs up, and so you can't see the mouth with those types of masks. But some of them that have more of the glasses type, I should probably grab mine. Should I show you? So the best mask for visual cues is one like this, where you put it on and you can actually still see the mouth, and you notice while I'm speaking it's not fogging up and getting that kind of condensation that you'll see with a lot of the clear masks out there. So this type is two-part. It does make the speech sound a little funny because it is reflecting clearly off of the mask, but at least you do get the visual cue when I'm wearing it, so it might change the speech quality a little bit, but you can still see my mouth. You can see me smiling or frowning or whatever the facial expression that's appropriate for that conversation. And so this type, where it's a glass frame and then this shield just snaps into the side, and these work really well. So we've been using these in our offices for the past few months with success. In summary, to help someone with hearing loss, it is best to speak slower, not louder, to rephrase a statement that's not being understood well, and to make sure they can see visual cues, so possibly without a mask, with social distancing, also improving lighting and decreasing background noise. Those are all great tips to help someone with hearing loss.